Hey everyone, it's me Kyla Marica Firma of BSN1C, and I am going to demonstrate how to check a blood pressure manually. But first, we need to perform hand hygiene and gather our supplies. We will need a stethoscope and a manual blood pressure cuff. So, let's measure a blood pressure manually. To do that, we want to make sure that the patient is sitting down with her arm at a heart level and her legs are uncrossed. Then, what we're going to do is we are going to get our stethoscope and our blood pressure cuff. And we want to make sure we get the right size cuff for our patient's arm, because if you use too big of a cuff or too small of a company can throw off the reading. And what we're gonna do is we're gonna palpate the brachial artery, because this is the artery we're gonna be listening to get our blood pressure. Because I'm going to get your systolic number, which is that top number, and this is the first sound we hear. Then our diastolic number, which is the bottom number, and this is the point where we no longer hear the sound. So whenever we're looking at the gauge of our blood pressure cuff, I want to make sure we're really noting those points, because it's gonna tell us our systolic and diastolic number. So, what we're gonna do is I'm going to put my cuff on my patient, and I want to make sure we find the brachial artery. So this is the artery we palpate that we'll be using to determine our blood pressure. And it's found in the bend of the arm, so we're going to find it. It's located here. And we're going to look on our cuff, and our cuff has these arrows. And because this is the left arm, we're going to make sure that these arrows is pointing in that direction of where that artery is. So I am going to put the cuff up about 2 inches above the bend of the arm. First, what we're gonna do is we want to estimate the systolic pressure, so I want to find the number. To do that, we're going to palpate the brachial artery, and I'm going to inflate the cuff until it no longer feels the brachial artery. And point when it no longer feels, it need to make sure that I am looking at this gauge to know that the number, because that number is our estimated systolic pressure number. Then, when I go to take the blood pressure, I'm going to inflate the cuff 30 millimeters of mercury more than the estimated number. Now, the whole reason for doing that is because we want to avoid missing the auscultate gap that can occur in some patients, and all patients have it, but some it's usually patients with hypertension, because the auscultatory gap it's like this abnormal silence that can occur, and it will throw off whenever you actually hear that first sound, which is your systolic number. So I'm inflating the cuff by feeling on the artery, and I'm going to note the point where I no longer feel the which about at the 100. Now I'm going to inflate the cuff to 130, and that will avoid missing the axillary gap if one was present. So I'm going to take my stethoscope, put it in my ears. So we're going to place that over the brachial artery. Do it lightly, don't fully compress it because you can include the artery. Then we're going to inflate our cuff to 130 millimeters of mercury, and we're going to make it fall about 2 millimeters of mercury per second, and we're listening for that first sandwiches our systolic number. Okay, it's 120 and we're listening for the last sound, and it was 75. So that the blood pressure is 120 over 75. Then once we read, we make sure that full deflate the cuff full of air, and we're going to take the cup of your patient. So that is how to check a blood pressure manually. Thank you so much for watching.